Hello, I'm Dr. David McFadden, and in the prior video, you just heard me talk about my 30th anniversary. I can't believe it's gone this fast, but here we are. So over the past few months, I've been telling patients that it's my 30th anniversary of fixing teeth. And many of them who have been with me for decades ask me, what's the biggest change you've seen in that 30 years? And I thought about it for a while, and unfortunately my answer is not a positive one. The biggest change in 30 years that I've witnessed personally is the decline in the quality of dental care that I see coming into my office. And why is that? I have my opinions, and my main opinion and my main explanation for the decline in the quality of dental care is that we're taking the wrong students into dental school. We accept students into dental school based on IQ and or their ability to score high on tests. That's it. There's no other prerequisite or criteria. The dental school admissions deans might tell you that it has something to do with extracurricular activities, this, that, and the other thing, but ultimately, the system is streamlined to accept only high intelligence people. That sounds great on the surface, but it's not great for the patient because many high IQ people have never learned to use their hands. And that may not even be an honest statement. Fine motor skills, the ability to get your hands to do what your brain wants them to do. Fine motor skills is genetic. You can refine the ability to use your hands with practice, but ultimately most of that ability is genetic. So think back to grade school. You remember coloring in grade school, right? And you remember who stayed within the lines and who didn't. Well, for the most part, that's a genetic example of fine motor skills. So in my opinion, I'd rather have a fairly smart person who can use their hands fixing my teeth than I would a person who's super smart that didn't get those gifts. Think about a person that does miniature sculptures. That's a person with fantastic fine motor skills. And that's who we should be accepting into dental school. You can get both. And that's the fallacy of the admissions process, is that you can get smart people that can use their hands, but they're not trying hard enough to find those people. So they've dumbed it down to the point where only the smartest people applying for dental school get accepted. The other huge improvement in dentistry is technology. We have amazing technology now, and we partially live in the digital world. And by that I mean we've got scanners, digital scanners on the front end, like a CT scanner or an intraoral scanner, that help us on the front end with diagnosis and treatment planning. Those same scanners and milling machines and 3D printers help us on the back end with the final product. But everything in the middle still relies on clinical judgment, ethics, and skills. So until a company invents a milling machine, a miniature milling machine that will work inside the mouth, the bulk of dentistry still lives in this world. It's an analog world where we have to use our best clinical judgment, our best ethics, and fine motor skills to produce a great outcome for the patient. I can't tell you how to find the people out there with the great fine motor skills, but what I can tell you is that you should trust your instincts. If your dentist seems highly competent, everything flows and is smooth when you're in their care, you're probably in a good destination. But if you have any doubts, if the doctor seems to be fumbling around or has to redo things on a frequent basis, I would think twice about staying in that practice and advise you to continue looking for that place where you feel the most comfortable. Thank you for listening.